Welcome to the Yorkton Regional Health Center Maternity Ward Tour. We will start our tour at the admitting entrance. When you arrive at the YRHC in labor for a scheduled induction or cesarean section, go through the doors that say emergency on them and head to the admitting area. Once in the admitting area, you will register and then proceed to 2nd West to the maternity ward. This is the elevator that will take you to the maternity ward. The staff from admitting usually lets the maternity ward know that you are on your way, and we usually meet you at the elevator. If you don't like elevators, you can take the stairwell that is right around the corner. If you come off the elevator, the doors open up right at the nursing station on the maternity ward. This is one of our 3 labor rooms. It's much smaller than the other 2 rooms. We typically use this room for assessment purposes, but we do deliver in here if we need to. If you come to the hospital thinking that you're in labor or that your water has broke, this is the room that you will be assessed in. This is a fetal heart monitor. Typically, we apply the external fetal heart monitor for approximately 20 minutes to assess the baby's heart rate and the contraction pattern. There are 2 numbers on the EFM. One is the baby's heart rate, and the other assesses the uterine activity. When you have a contraction, the number on the monitor goes up. The number itself is subjective and is based on where the paddle is placed or how tight the straps are. What we really care about is the start of the contraction, the end of the contraction, and what the baby's heart rate does in relationship to that. Once the monitor strip is completed, and based on our assessment, an internal examination of the cervix may be completed. There are some cases that we will not do an internal cervical exam. Those instances may be if your water has broke and you are not contracting, or if you are actively bleeding from your vagina. If you come in thinking that your water has broke, we can test that and confirm it in a couple of different ways. One is a nitrazine test. It's a litmus test, and your amniotic fluid is alkaline, and if your water has in fact broke, this will turn black. The other test that we can do is called a ferning test, and we take a sample of the fluid and we put it under the microscope, and it looks like ferns or almost crystals on the bus window when you were a kid. If we confirm then that your water has broke, then we admit you and ask you, it seems like, about 1 million questions, and if you're not in active and established labor, then we'll transfer you out to our ward. Around 36 weeks, you would have had a Group B strep swab done by your healthcare provider. If this was positive, then IV antibiotics would need to be started when in active labor or if your water broke. The antibiotics help protect your baby from this bacteria. GBS is a bacteria that may be found on a woman's vaginal or rectal area and causes no harm to mom, but may cause severe respiratory infections in neonates if left untreated. If you are in early labor, which is a closed cervix to 3 centimeters dilated, and your water has not broke, we may send you home until you are in a more active stage of labor, which is 3 to 4 centimeters dilated, contracting regularly, which is at least every 5 minutes, lasting at least 1 minute for at least several hours. The cervix has to do 2 things in labor. The first thing is thinning out. This is called effacement. The second is dilation. This is the cervix opening up. With our first-time moms, we often see the cervix thinning out first, then opening up. Early labor can last several hours or even days. Once in active and established labor, we keep you in one of the labor rooms. You will stay here until after your baby is delivered. Our standard practice is to delayed cord clamping and do immediate skin to skin. The first hour of a baby's life is called the golden hour. And with the baby-friendly initiative, the goal is to initiate breastfeeding. If mom and baby are both stable, we keep the dyad together and assess the baby in the labor room or transfer the mom and baby dyad to the nursery for the baby's initial assessment. Common questions our patients have are usually about pain management and coping strategies in labor. In Yorkton, we have several options. In early labor, we offer and suggest natural methods for coping with labor. First, birthing balls, movement, showering or bathing, breathing, massage, TENS machines if you have. After first trying these methods, we then will offer morphine, which we give IM or IV. In active labor, we use fentanyl or an epidural. An epidural has two medications, one being fentanyl and the other being a local anesthetic or numbing medication. We also have Entonox gas, otherwise known as laughing gas. We encourage our patients to move, walk, use the birthing ball or peanut ball during labor. Position changes are important to help facilitate fetal descent and aid in the progression of labor. As we say up here, motion is lotion when it comes to labor and delivery. Here is our nursery, where a baby will never be for very long unless necessary, and baby needs to be monitored or provide medical care. Baby might need phototherapy if their bilirubin levels are high. Phototherapy is a special light treatment that helps the baby's liver break down the bilirubin in the blood to lower the bilirubin levels. If baby is breastfeeding, mom may need to use a breast pump to establish and maintain supply. There are breast pumps available for use while you are in the hospital. And then, when discharged, the early visiting program in Yorkton has pumps available for rent should you need one. On our maternity ward, we are lucky to provide pasteurized donor human milk for babies in the cases where supplementation is necessary or mom has not established a supply to meet her infant's needs. Our maternity ward, along with Yorkton Public Health, also accepts breast milk donation if you have excess breast milk. Donations are collected at both locations and sent to Northern Star Mother's Milk Bank in Calgary for processing. And the same milk will come back to our wards and hospitals in Saskatchewan for our babies. This is the hallway where our patients stay. If you are admitted for a scheduled induction of labor, you will be admitted into one of these rooms and transferred to a labor room once in active and established labor. We have 3 public rooms, which have 3 beds in each of them. Patients are allowed to have one support person stay with them at all times. Children are not allowed to spend the night and are not considered a support person. Families need to know that sometimes we don't have enough pull-out sleepers for support people to sleep in, and they may have to sleep in a chair. The showers and bathrooms are on the right-hand side of the hallway, and due to the old infrastructure of the hospital, sometimes we cannot get hot water in all of the private room showers, and patients end up using the public patient showers. I tell all my patients who are upset if they don't have a private room that I stayed in a public room and used the public patient bathrooms and lived to tell the tale, and you will too. We have 5 private rooms that all have private toilets. Not all the showers are functional, but you do have more privacy for you and your new family. They seem large, but if you have a baby cot, pumping equipment, phototherapy equipment, and company, it fills up pretty quickly. The private rooms are on a first-come, first-served basis, unless we need them for someone who needs to be isolated or for someone who has suffered the loss of a pregnancy. On very rare occasions, we have had to bump people out of the private rooms for these reasons. This is not something staff wants to do, but it is sometimes necessary. Down the hallway, we have our nutrition center, where snacks and drinks are available to our patients. There is also a sitting room in which families can wait. What happens if you're having a scheduled or an emergency C-section? If you've had a spinal anesthetic or an epidural top-up, then you're allowed to have a support person in the operating room with you. If you've had a general anesthetic, which means you'll be sleeping during your surgery, then you will unfortunately not be able to have a support person with you in the operating room. Once your baby's delivered through the cesarean section, we take your baby to a warmer like this and make sure your baby's okay. And once we think everything's good, we will give the baby to you and your support person to take pictures and touch and engage with your baby. Then we will take the baby down to the nursery to complete the baby's assessment. The support person will come with me or another nurse down to the nursery and we'll complete that assessment. And then once you are in the recovery room and everything is good, we will bring the baby up with either a registered nurse or a lactation consultant. Then we have baby room in with mom and support breastfeeding with the mom and baby dyad. The early visiting program nurses will also come to the ward after baby is born during the work week and do a voluntary in-hospital birth questionnaire with you that helps establish and sustain early childhood programming in our communities. You do have access to a lactation consultant. If you are wanting that additional support for feeding, there is a lactation consultant available on the ward part-time, and there are community lactation consultants that can be accessed through public health and can see you still while you're an inpatient. That's it for our tour of the Yorkton Regional Health Center maternity ward. We hope that you found this information useful. We would like to thank our partners in programming, Yorkton Regional Health Center, Public Health, and Kids First for making this video possible.